Have you been diagnosed with a lumbar disc herniation? Are you looking for exercises to decrease your pain or maybe improve how you're recovering? Well, there are things you can do besides surgery. In fact, only really severe cases of a lumbar disc bulge or herniation lead to surgery. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and I'm going to show you a few exercises you can do to help with your pain and speed up your recovery. So the most important thing we want to do if a disc is bulging backwards towards the nerves is send it forward away from those nerves. And that means that we want to bend backwards. So to do a standing back bend, you're going to place your hands on the flat bony part of your back right below the curve in the low back. You're going to elongate your spine and you're going to send your hips forward while your chest lifts, arching your back. Hold for 3 to 5 seconds. And then release, and then repeat. And repeating is the most important part of this process. You can do 5 to 10 of those every hour all day long, and that's going to help decrease that feeling of pain and pinch and maybe even numbness or tingling. If you want to do a back bend and go a little deeper, we can use gravity by lying on our stomachs on the floor. Now, it does help to use the floor because it's firm, but if you're worried you won't be able to get back up again, you can do it on your bed. So lying on your stomach, you're going to take your elbows underneath your shoulders, and you're going to let your hips and your stomach relax towards the ground, coming in to a back bend. Now, it's a little easier in this back bend to hold it longer, so hold it for at least 5 seconds, up to 30 seconds, and then you can release and then repeat again. If you feel like you might be able to go a little further, your back's not spasming, you feel like you have a little bit more range, you can slide your hands forward and come up into what we call a sloppy push-up. So this is just going a little bit deeper. Hold for about 5 to 10 seconds, and then relax, and then repeat. One more back bend you can try is lying on your back in bridge pose. So you're going to lie on your back, feet flat on the floor, hips hip width apart, legs hip width apart. And you're going to imagine though that the legs are holding something between your legs but not touching. So you're activating the legs. This pose helps work our glute muscles, which help with hip extension as well as support the low back. You can place your palms on the floor. It's okay to use your arms a little bit, and you're going to lift your hips up off the ground. Hold for 5 seconds and then lower down with control. And then you can repeat this, lifting, holding, and lowering. Depending on how fatigued your muscles are, which they might be if your disc is really irritated, you can do 5 to 10 times. So there are options for exercise when you're suffering from a disc bulge, and trying just some of these simple back bends can give you relief. If you want to recover even faster, you can book online with us at willowbrookchiropractic.com. We post regular content on YouTube, Facebook, and Instagram under Willowbrook Chiropractic. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.